Fox 5 Health News, the road to recovery after battling COVID can take a long time. Experts say some patients may still have symptoms weeks or even months after being diagnosed. Joining us now, Dr. Purvi Parikh, Clinical Assistant Professor of Pediatric Infectious Diseases and Immunology at NYU Langone Health. Doctor, thanks for being here. And we are hearing more and more of this, people who suffer for months after their initial diagnosis with all sorts of really intense sort of problems they've been dealing with. And we don't really know much about how long the road to full recovery is at this point.
Right, absolutely. I mean, everybody's been focusing on the death rate, but, you know, a lot of the long-term consequences are not talked about. You know, COVID-19 can cause long-term lung problems, heart problems, blood clots. Virtually every organ system's affected.
Mm-hmm. One of the symptoms you hear about is thickening of the blood. What can you tell us about that? That's something I've never even heard of in context of any other disease before.
Right. So it is very unique to this virus in that it can cause blood clots. Mm-hmm. And those blood clots can occur anywhere, from your heart, causing a heart attack, your brain, stroke, and various other places in your body. And blood clots, they don't disappear overnight. That's a long-term consequence that people will have to manage and possibly be on blood thinners for months to even years or more, depending how severe their disease was.
Yeah, scary. It's a great reminder to keep your guard up against it. Well, there are now several COVID-19 tests available. Some claim you can get results within 15 minutes. Always the question when you get to those sort of quick test results like that is how reliable are they? What are you hearing on that front?
Right. So, you know, it's nice because now we have a way to diagnose the active disease quickly, so you're not waiting, you know, days for the lab to get back to you. But you're right in that sometimes the accuracy is sacrificed with these rapid tests, so you have to take it with a grain of salt. There is a high false negative rate, and we see that a lot even with rapid flu tests, rapid strep tests. So it's good. We have another tool, but you know, it's not 100%.
Right, indeed. All right, and today the World Health Organization now saying the coronavirus may spread through tiny airborne droplets. That's been a big question, especially as we try to get businesses inside open once again. That could have pretty profound implications. It's a scary development. What do you make of that?
Right. You know, it's not meant to panic or scare people, but, you know, we do know that droplets can travel for quite far, especially if you cough or speak loudly, and that can cause it to be airborne for minutes, even up to hours. So this underscores the need, you know, for masks, appropriate ventilation indoors. So again, it's just for us to be prepared and take those right steps rather than to panic or be scared by it.
All right, the more information, the better, and we continue to learn more and more every day, it seems. All right, Dr. Purvi Parikh, we appreciate it. Thank you for being with us.